Hello, everyone, and welcome to the final installment of the Basics of Ultrasound lecture series at Mountain View Hospital and Sunrise GME Health Consortium. This last lecture is discussing our workflow. Now, if there are any of those of you who have been joining us for the physics or the knobology, you may not find this last lecture as helpful unless you're trying to set up a workflow of your own and you want an example of how it's been done sort of elsewhere. And if that's the case, or in any case, you are more than welcome to join us for this lecture as well. But again, just with the caveat that this may be less useful and less generalizable than some of my previous lectures. So our objectives in this lecture, we're going to discuss what exams ACEP considers core, how to use the ultrasound machines at our hospital systems, and how to use QPath to save interpretations and review your feedback on your exams. So first, let's talk briefly about exams in general. You need 150 of any exam type to graduate with 25 exams in each field you want to be credentialed in as an attending. Here's a list from the ACEP Ultrasound Tracker. I'm going to leave hovered on the screen here because you can actually put this into ACEP's website so you have a more graphical representation. I think we do a good job of showing you what your exams are like on your own, and I'm going to go over that in a minute, but just so you can see another option here. But this is the list. It's certainly not considered an all-inclusive list, but it is considered to be core to EM. The exceptions would mainly be this others. So that's, some places credential attendings for testicular and GYN and other sort of indications that we generally consider outside of our scope for all but the most advanced of attendings. But some places do allow that. And that's something to consider, and we actually certainly allow a lot of those more advanced exams to be performed as long as it's under proper attending supervision. You'll notice that two of these exams are marked, the cardiac and the obstetric, basically because each one of these are all external exams, right? So your FAST exam, procedure, the ultrasound probe is on the outside, it's a non-invasive exam. Both the cardiac and the OB have invasive forms of their exams. Cardiac has the transesophageal, and OB has the transvaginal. So in each of these exam types, you need your 25 that ACEP requires you to get to be credentialed in the external exam, and then an additional 10 in that internal modality in order to be credentialed in that. So if you get 25 external OB exams and then you get 10 more transvaginal OB exams, then you can be credentialed for both. And same sort of story with TT and TEE on the cardiac side of things. So this is your patient interface, and you always want to scan the patient's wristband first whenever possible. A lot of times it'll actually erase your 3-4, which goes in this field right here, this resident field, and I think that actually pops up. Yep, this is your resident field. So that's where you want to put your 3-4. The software is such at Mountain View that you can actually scan the back of your badge where it has your 3-4, but Sunrises will not currently allow you to do that, but that may be a change that we can expect in the future, that you'll be able to scan your badge at Sunrise as well. So when you're scanning and you're on an ultrasound shift, you want to make sure that whoever is on that shift puts their 3-4 in and does the interpretation. That way, whoever is working clinically can sort of return to their clinical work. Now, if you have like a John Doe situation or a code where you don't have access to their information yet, but you need to get that scan started, you can go ahead and start it, right? So the machine won't allow you to end the exam without entering an ID. So you actually can't just start the exam and then it'll prompt you to come back and say, hey, by the way, you haven't put in ID yet. And as a caveat, a couple of little caveats about this ID thing. So first of all, there's this auto ID thing. You can use that if you don't have the information available yet, but just be aware you will have to fix that in QPath later. Not a big deal. Really easy process, and I'm going to walk you through it in just a few minutes here, but just be aware you're going to have to do that. Other reasons you may have to do that is if you scanned the wrong band. So patients have blood bands, right? If you scan the blood band on accident, you won't pop up with any patient information. It won't be able to go to the chart or to anything. So you want to make sure you scan the correct band that has their name and everything on it, not just the blood band. Now you can tell the difference between it because at our facilities, all of our patient IDs start with a G at Mountain View, a D at Sunrise, or an H at Southern Hills if you happen to be doing an elective there. So if it doesn't start with one of those three things, you scan the wrong thing and you need to double check it. Don't put any of this other information in because it will actually interfere with QPath's ability to tell what you wanted to do or which patient it is, and it can actually screw it up. So please don't put any other information, just scan the wristband and put your 3-4 in. In the future, we may ask you to put some information for the attending. How we'll do that remains to be seen, but that's a future possibility. Once you have that set up, then you can go ahead and select your probe like we talked about before, and then select the actual preset by selecting the arrow by it, and then select the actual preset. All right, so what are we going to use on this screen while you're actually scanning? So this is a really good sort of overview on everything that you have here. Obviously, we had that first patient screen, right, that we've already went over. This is considered your scan screen. There's two ways to look at images that you've already taken, and that's right here with Review and right here with Clipboard. Clipboard doesn't interrupt your active scan. It pulls up what you have, so it's useful in the situation of, oh, did I save that image or still, did I save that clip or still already? And certainly if you didn't, you'll be able to pull it up and see, okay, yes, I did, and then move on to the next image. And if you don't see it, you can go ahead and do it. Whereas Review will take you completely out of the scan mode, and it can be a little bit more obstructive in that regard. But if you're trying to show a bunch of your images to an attending or to someone else, then you want to use this Review tab here. This you can ignore for now. Here's your probe selections that we talked about before, right? So you press them, you click one of these, well, press is more accurate since it's a touchscreen, right? And it'll pop down with all your available presets, and then you select the correct preset. Over here, you guys generally won't need to turn the machine off. If it starts having errors and it's just acting funny, then you can turn it off and then back on. That takes several minutes, but that fixes a lot of errors. These two you don't ever need to deal with. Clean will actually shut the screen mostly off and allow you to just wipe down the screen with the cleaner. What it does is basically ignores all touches except for a specific touch, which is like a swipe across the screen. The old version was touching two places at once, so that way you can safely touch the screen. You don't need any of this stuff either. We don't have a printer on ours, so this is not a big deal either. This is the freeze button. So this button will stop the screen so you can actually see what's going on. And then I would recommend whenever you're saving an image, either a still or a clip, that you always use the freeze button, because you can always convert it back to a clip by clicking this play button over here. And then the store will save either the image or the clip after you have added the label, which is under here in comments, and then added any appropriate measurements, which are under measure. You don't want to click this full screen button because it just gets rid of a lot of these buttons and makes it harder to see things. And then a couple of last things that you can't see on here. Usually there'll be a couple, if you go into clip mode, there'll be two brackets that'll show the start and stop of the clip. You can actually grab those brackets and expand or contract them. So if, for example, you have a clip that is your standard 4-second clip, which is how long ours are set to record, but you want it to be longer, either because you're fanning through something or trying to show something that it needs more time, you can grab whichever end you need to move and just move it. It'll make more sense when you actually see that on the screen. And then also, if you have, like, for example, you were moving the probe, or the patient coughed or did something that caused the image to be unclear in the beginning, for example, of a clip, you can cut down the front of the clip so that it's only showing the meaningful part and not sort of, as someone I worked with in the past would describe it, a oopsie clip or a seizure-inducing type clip where you're showing lots of motion on the screen and it just is hard to concentrate. There's one more thing that pops up on here, and that's the anatomic M mode. It's generally right here. If it's available, it'll say like AMM or something like that. And basically what that does, that lets you retrospectively do M mode on an image. So say you have, this is a cardiac exam instead, and say you have a heart that is lopsided, so you want to do an EPSS, but the valve is over like this, right? If you try to do an M mode from here, you're going to end up getting a way artificially elevated M mode or measurement right here. Whereas if you use anatomic M mode, you can actually say, all right, you can set a gate here and say, this is the structure I'm looking at, and then this is the direction I want to do it from, and you can get your M mode this way, which you can see would be much shorter and actually more accurate. So this is something that I think GE does well, and it's available on our machines, and I think you should certainly use it and learn to use it, because I use it all the time and love it. That is one of the things to be aware of that we have available to us. And yeah, that about sums up what you need to know about working with the machine here. And then, obviously, when you hit this end exam button, that closes everything out. That also transmits the exam to QPath. So you want to make sure that you end this exam before you try to fill out an interpretations. If you never ended the exam, it won't ever show up for you to be able to actually look at it. All right, a few tips. Make sure that you label absolutely everything. And this is something you really have to be careful for because it's really easy to whip through the exam and not put labels on, and then I'm not as sure about what I'm looking at as I could be. This is especially true with like the skin and soft tissue where there's not like standardized views, right? If you send me a parasternal long axis, even if it's not labeled, I'm probably going to figure out it's a parasternal long axis. It's still not the right way to do it, but it's something that I can still sort of interpret. So that's a little bit easier. Whereas sometimes you have ones like an abscess. Okay, well, what's the location of the abscess? Because that changes a lot of other factors as well, right? Make sure you take your time. Be really patient and methodical, especially if you're scanning independently, because you guys are just learning, right? Generally speaking, maybe not everyone, but most of us are just learning. Some of us are continuing to learn over time, but you're still learning. So it is okay for you to take an ultrasound that lasts in a stable patient 5, 10, or 15 minutes. That is totally fine because you are learning how to do this properly. We really put a lot of focus on high quality stills, and these well labeled high quality stills are often very, very adequate, or sometimes in some cases better than, there's certain are in either case better than bad clips, right? I would much rather see a great still than an okay clip. Once you've frozen the screen, you can still move along the timeline. You can take multiple stills, so that way you can focus on just their scanning when you're doing it and not worry about getting the perfect clip. And you can get that view that you want, and then you can save your best images. When it's appropriate, get clips. My general rule is if a structure is moving, you should probably have a moving picture of it, right? So that's generally your heart and lungs almost exclusively. It can also apply, for example, in the eyeballs. If you have the patient look back and forth, you're looking for like a vitreous hemorrhage or something to see if there's a washing machine effect. Anytime you have a moving structure, a clip is probably better. Not always, but probably. Or again, you have a baby and you're showing fetal movement, all of these things. If you have something that's moving and you're trying to demonstrate that movement, oftentimes clips are the best way to do it. That being said, when you press either store or freeze and play to save the clip, that machine actually plays the clip back to you. So like I mentioned before, you can adjust the beginning and end of it. You want to look at that clip and make sure it is what you want and no more and no less. You want to make sure that you are telling that story that you want to tell. And then if you see any pathology, you should take lots of pictures and clips, right? Like if you have a totally normal DVT exam, you just have your 5 pictures down the leg, that's fine. If you have a totally normal cardiac exam, you have 5 clips, you have your parasternals, long and short, you have your apical, you have your subxiphoid, and you have your IVC, and everything looks totally normal, that's fine. If you see, especially if you see serious pathology, you should take more images rather than less, because that's sort of the right thing to do, right? You want to really show the pathology that you're trying to demonstrate. And then, like I mentioned on the last slide, if you can't find the images, overwhelmingly, the exam wasn't ended yet on the machine. This comes up every month or so. Someone says they can't find their images, and it turns out it just didn't end the exam the whole time. So, speaking of QPath, let's talk about QPath a bit. So what is QPath? So it's known as a middleware application. It's the interface between the ultrasound machine, the PAC system, and the EMR. In our current implementation, we only use it for storing and performing quality assurance on images for residents, but it also can be used to send those images up to PACs, which we do occasionally when there's a clinically relevant exam. In the future, we might use it for billing and credentialing and other processes, but this is what we use it for at the current moment. So how do you get to QPath? Well, there's a few different ways. The easiest is going to be the Launchpad shortcut. So you'll learn about the Launchpad if you haven't already. This is what the Launchpad looks like. This is what my Launchpad looks like specifically. And then that is the QPath icon that is highlighted. And you can go into this button manager option here if you don't have it and add it. It's called QPath for MVHO, and it'll show up here. Also, if you don't like looking at these tiny icons, you can click the Launchpad button here and it'll show them all in alphabetical order with the text beside them, so it makes it a little bit easier to find. However, on some computers, Chrome is not working properly and it'll give you an error when you click that. If that happens, the first thing you should do is you actually contact IT about which computer it is so they can fix it. But the next thing you should do is go through one of the other options that we have for getting to QPath. So you can use the link on the hospital intranet. This is a little bit clunky, but if you open up the hospital intranet, you can go to links on the Mountain View page, and then it's like down in the bottom right corner, I don't remember exactly where it is, or you can just hit Control F and search for QPath, and it'll show up and you can get there. You can also memorize the URL. I don't particularly recommend this because it's a really annoying URL. It's not like it's just QPath.mountainview.com or something like that. It's a combination of letters and numbers that makes no sense. But you can actually make an M modal shortcut, and I have a video demonstrating how to make that shortcut, just because that is another option in case you have one of these computers where Chrome isn't working. That way you still have access to getting on and taking care of your interpretations and everything. And certainly on all your laptops, it should all work properly. So when you open up QPath and you log in, you're greeted with this thing called the Start board. It should not launch directly into the Exams tab. I should have this all set up for everyone, but everyone's start board should look like this. So if it happens to open up right away, then you might have to right-click the Exams, and it's like you have to hit Customize and say Open by default or something like that. It's really weird. I should have that fixed. If not, let me know, and we'll discuss how to deal with it. So basically, here are your tabs that you need to know about. This is all of the exams performed by anyone, basically anywhere. So this is useful to keep there because if you happen to not put your 3-4 on, or if someone else put their 3-4 on and you're going in and adding yourself, this is where it's going to be. So you need to be able to see all the exams. Anything that has your name on it as an operator, whether it's a primary or not as a primary, doesn't matter. It'll show up in here. Any exams that you haven't signed the interpretation on, and I'll talk about that in a minute, so that way I can see them for QA purposes, they show up in here. And then any exams that I have finished the review of and have given you feedback on will be here. And then lastly, and in some ways most importantly, this right here is your progress reports, and it basically will tell you how many of each exam that you've done that I QA'd, said this qualifies for credentialing, this one you get credit for. Both for graduation and then for credentialing in the future, right? And it also gives your total down at the bottom. Now, one thing to note about this particular tab is that if you do, for example, an ultrasound guided IV or central line, currently those don't go to QPath, so you have to put them in MedHub, and those won't show up in this number, so you will have to look at that separately. I'm discussing with actually Dr. Hart whether we can make all ultrasound guided procedures just one procedure on MedHub. So instead of saying central line, it's slightly more annoying because then you have to put it in twice, but then it makes it really easy to monitor your number of ultrasound guided procedures, because that's what it will be labeled as, just general ultrasound guided procedures. So that may be a change that we're seeing this year as well. So just keep an eye out for that. That would make it a lot easier for you to track your number of procedural ultrasounds, which in exchange also makes it easier to follow up on it and keep accurate counts. So next thing to talk about is the edit tab. There's a few different things this is used for. It's used for assigning exams operators and attendings in the future. It can be used for changing the patient. If, for example, you did an oopsie and scanned a blood band or put in an auto ID on a John Doe or something like that, this is what you use to fix that. So when you're in an exam, or in particular, this is in the list of exams, but you should see similar options when you're actually in the exam. You'll see this button that says edit. Once you click that button, you get a tab like this. So you have the exam type here. So if you, for example, were in the wrong presets for the entire exam, this is where you would fix that, as long as it is one exam. If you did multiple exams and didn't change the preset, that's going to be in a later slide. Adding yourself as an operator, you use this button here, and then it'll pop up with all the names. You'll show up at the top. So this is the other reason why it's easier to add yourself than it is to add someone else. So you want to have, probably whoever else is scanning, if you're planning to do the interpretation, have them put their 3-4. That may contradict what I said earlier, because what I said earlier may have been wrong, but that's okay. But yeah, you go in here and you can be able to add yourself, and then you just want to make sure that you click the save button up here when you're done. There is one last thing here, this change patient button. This is, again, if you scan the wrong barcode, whether it was a blood band or you scanned the wrong patient's barcode, right? That does occasionally happen. If someone hands you a stack of stickers and you scan the wrong one, now you need to fix that. So you would click this button, and then you start typing, and you type the patient's name. You can type their MRN as well, and it'll show up with that, but it's the MRN, not the account number, and you have to have the zeros in there, or you can just start typing the number. So for example, here, you can just type these numbers, and it'll pop up with that. Next thing to talk about is how to split up an exam. Now, again, like I said before, you should be changing presets every single time, so this should not happen, but it does happen occasionally. Another potential option would be you change presets but you hit the wrong preset. Another option would be, for example, you had a patient who was a cardiac arrest and you got ROSC, you did your exam during the cardiac arrest and even got the ROSC, and then you go back afterwards to reassess them, or maybe vice versa, right? Maybe you have a patient who was fairly unstable, you did an echo on them, you got all your results, and then you had to go back and rescan them because now they're in arrest, right? So those are two different indications, or a fast exam that you repeat because the patient is now hemodynamically unstable and you're worried they're bleeding blood into their belly. These are all great reasons to repeat an exam. And the way you would fix that, because once QPath gets it, it doesn't know that it's a repeat exam. Even if you say new exam on the machine, sometimes QPath doesn't get it and will still put them together. It goes, oh, it's the same account number, it's the same date. This must all be one exam, right? And it's not always right. So this would be a reason to go back in and do that. Just make sure that on those repeat ones, there's a checkbox on the worksheet when you're filling it out, and we'll talk about worksheets in a minute. There's a checkbox on the worksheet that says repeat exam. Make sure you check that box to say this is a repeat, just because in the future when we're billing, if there's a new indication to do an exam, that gets billed out again, so you need to document that it's a repeat. But coming down to it, so you have this little button here that says image operations. It should show up in both on the main screen in the exams and then inside each individual exam it should show up. And you're going to click that button and it's going to show you this. You may have to maximize that window because sometimes it starts not maximized and it's a little bit difficult to work with. And you want to make sure that you select all the I got ahead of myself a little bit there. That's okay. Select all the images you want to split off, and the way you do that is it's just like selecting files in Windows Explorer. So you can either hold Control and click each individual one, or you can hold Shift and go from the first one to the last one. So you say you want to do this one through this one, you can click this one and hold Control and click this one, this one, this one, this one, or you can click this one, hold Shift and click this one, and then you can click the split button. Also, if you want to export the studies because you want to give a presentation or something on it, this is where you would do that as well. If you have none of the images selected, it will export them all by default, I think, or you might just have to hit select all, or just whichever one specifically you want to export, and then it'll export it in a zip file. But this is where you would do that as well. Once you click the split button, it pops up with this, and you're going to basically pick what exam type your new exam is. And it has the whole list. They're mostly in alphabetical order. There's a few at the end that are not in alphabetical order. That's a problem we've been working on trying to fix, and maybe it'll get fixed this year. We'll see. But regardless, let's say, for example, you did a fast exam and a cardiac exam, right? And you went, oh crap, I used the same probe and I didn't change it from fast to cardiac, so now everything is under the fast exam, right? Not a big deal. You select all the exams, all the pictures of the heart, right? And then you want to move or copy them, right? So most of them are going to be moved, right? All the ones that are not normally part of a fast exam, you're probably going to just move. But like the subxiphoid, or at least whatever your cleanest picture of the heart is, you want to keep at least one picture in the fast exam because that's what makes a fast exam. A fast exam is heart plus belly, right? Or EFAST as well, heart plus belly plus lungs. You have to have a heart picture in there, sorry. So you want to make sure that you click move for all of them, and then you would actually select the individual one you wanted to keep in that exam, and you would hit copy. And then you could click your cardiac over here. And so you've got cardiac, right? Move, and then you change whichever one you want to keep to copy, and then you click done, and it'll go ahead and make 2 exams for you. Occasionally you have to unsplit exams. This mostly happens as a result of splitting improperly. So what I mean is you do an echo, and then you do an aorta, and then you do a kidneys, but you forgot to change the preset between the aorta and the kidneys. So now you've got a couple that are right and a couple that are wrong, or other situations. This doesn't come up too often. Most commonly it's exams that needed split that don't get split, but this does occasionally happen. Or if you split it up improperly and you went, oh crap, for example, I meant to copy that subxiphoid image and I moved it instead. Well, the way you fix that is you go back to the tracking board, the main board here, the exam page, and you click this unsplit button. So this unsplit button will collapse the entire exam back down into one exam. So yes, you'll lose all your progress on making sure everything was filled out properly, but at least you'll be able to split it out properly after that. Next thing to talk about is your interpretation worksheet. So this is a small view of what an interpretation worksheet looks like. I have another bigger one coming up, but I just wanted to zoom in on a couple of things here. Namely, I wanted to zoom in on these asterisks. So you have these asterisks here, you'll notice. These are just saying that these fields are required, that you have to fill them out. And then here's one example of the repeat. I think this has been updated, but one example of the repeat exam checkbox. And then once you've actually gone ahead and filled those out, you'll see now you have green check marks here, indicating that you have a required field that has been filled out. There is another green check mark that we'll go over at the top. So we use what's called smart programming. And what that means is that most of any given worksheet is actually hidden. It's revealed as you click through the parts that you do see. So this kind of helps decrease a lot of clutter. One of the examples is, for example, if you have a FAST exam that you stopped right after the right upper quadrant because there was free fluid, you didn't get any of the other exams, then as you click right upper quadrant and then the findings show up. You know, your interpretation is obviously still there. You'll say it's a positive FAST, but you won't have to put findings for any of the other things because you didn't check the box that says that you saw it, so it didn't bother to prompt you to put in findings. Other examples could be like this one here, where we have all the findings, right, of the gallbladder, and we went ahead and said, oh, it's a normal gallbladder. If you check that, everything else goes away. Again, it just helps to declutter things and makes it a lot easier for you. And then another example here would be, oh, I actually saw the CBD. See how it's unchecked? Once you actually check the box, now you have CBD findings that appear as well. And one of the recommendations that I would make is that if you want to document your exams in Meditech, it's often easiest just to, once you're done with the worksheet, and we'll talk about a little bit more later about being done with the worksheet, like I said previously, but you can actually lock the worksheet, so it creates just a text block that has your interpretation and findings and everything, and I would copy and paste that into the interpretation diagnostics sonography tab in Meditech. Once you see it, you'll know what I'm talking about, but it's much more detailed than just typing a one-liner in your MDM, did a bedside ultrasound, did a point of care ultrasound, and saw free fluid or whatever. It's just a little bit more detailed. All right, so the next up is talking about QA, and this is the process that I mentioned earlier where myself or one of the other ultrasound faculty will review the exams that you've submitted and give you feedback on them. And we give feedback in specific detailed ways I'll go over momentarily here, but here's the example worksheet, and we're going to go through just a couple other things you should know about it. First of all, you have this exam worksheets option here. What this does is this allows you to switch between different worksheets that may be present on a given exam. So for example, the cardiacs have a cardiac arrest worksheet in case you're doing it for an arrest. Doesn't really make sense to talk about EF if someone's pounding on the chest, right? The EF is whatever, you know, that person's chest muscles and compressions allow. The other example would be the FAST exam because we don't have separate FAST and EFAST presets. So it all becomes an EFAST in QPath. So that allows you to go in and pick the FAST template instead, which is just a little bit more pared down. It's a little bit easier to fill out, very slightly, but it is, than the EFAST. So that allows you to do that. We also have the set default option. In the near future, I'm actually going to have defaults for pretty much every exam indication. There may be exceptions. The soft tissue is going to be one of the exceptions because we often do it because we think there's cellulitis and we're looking for an abscess. So that really doesn't make as much sense for me to set defaults on. But for example, if you have a normal kidney exam, you know, and you can just with one button click that set defaults, and now you have your entire thing filled out with all the normals already pre-selected for you. Or you have a normal cardiac echo, right? Same thing. Click set default. Everything's set to the defaults. The other option here is this clear button here. This basically wipes the entire worksheet. So if you made a few mistakes, or for example, you filled out the wrong worksheet, then you go, oh crap, this was a regular, I filled out a regular cardiac worksheet. This was supposed to be an arrest, right? You can hit clear and it'll wipe everything away because otherwise it'll still save those responses that you did and it'll have it there when I pull it up and it sort of won't make any sense. So those are just your options there. And again, as I called out before, you have your little red asterisk here, right? So once you've actually filled out your worksheets, those all become green check marks, and then you get a nice little green check mark at the top. And now once you look at the bottom of the worksheet here where it says sign, you can use the pen to sign as well. But if you look over here, it actually still says, please fill out our required field. So you are not allowed to sign the worksheet until it's done. So that's this is actually a new change from previously. Some of you who rotated with us may have seen residents do it slightly differently, but this makes sure that you get the worksheet done every single time. Once you've signed it, then you'll see your name down there. You'll notice that the worksheet is not locked. You can still use it. So if you made a mistake, once you go and edit anything on this worksheet, it will unsign the worksheet, and then you'll have to re-sign the worksheet. Now, we do have the ability to do the interpretations directly on the machine and also submit for QA directly on the machine, or rather sign them. We used to use the submit for QA button, but we don't anymore. You should not be using this when you're on a scan shift if there's a resident scanning, because you can't add them from there, so you want to make sure that you use the full QPath. But just for example here, let's go through the process. You end the exam once you're done, right? You click yes. Now it throws you back to here. Wait a few seconds to a minute. Come back and plug it back in. Make sure it's uploaded the exam, and then you're going to click the exam, which is usually the first one, and you're going to click Q View. Once you click Q View, you want to wait until the page refreshes. So it's going to open, and it's going to refresh. Sometimes it's visible, sometimes it's not. In this case, because I opened up the same exact one, it didn't do it. And then next, you want to double check to make sure all your exams are present. So this is under split exam. If you didn't change your preset appropriately, then not all of them will show up, and then you can't use QView. You have to go into full QPath. The next thing you want to look for is if there's a change in the worksheet. For example, the cardiacs. You can find that here. This is where you will assign yourself if you didn't previously assign yourself. And then if you're doing, for example, one exam and you noticed it was under the wrong exam type, you can fix that here. Now, it does auto-save each time you assign an operator, so that's helpful, but it doesn't go down to all of the exams. So you have to assign yourself on every single exam. If you don't assign yourself on every single exam, you won't get credit. As you just see, it's the exact same process on each one. Now we're going to come back to this, and I'm going to fill out the worksheet. You just tap it. If you need to put free text in a field, then you would click this keyboard button first and then select the box that you need. Once you get all the way down to the bottom and you filled it all out, you can click the save button. There's also a save button down at the bottom as well. And then what you want to do from there is there's an extra button up here now that says sign as, and you want to click that sign as button and enter your 3-4 and your password, and it will actually sign it. You'll actually be able to see up here it'll put a little pen icon with your name saying that you signed it. Once it's signed, you have to do that for each individual worksheet. Once they are signed, that goes into my queue to review it and to give you feedback on it. And then I mentioned briefly before that you can change the worksheet. So this is the most important for a cardiac when you're doing a cardiac arrest instead, and it's just right up here. You would switch to cardiac arrest. You can see it's a totally different worksheet. Other than that, the process is exactly the same. I just wanted a dedicated video for you to see how to change the worksheet back and forth. All right, now how to view your QA. So this should be set up that you see it by default. If it doesn't work properly, I want you to let me know. But what you would do is you would select this little icon here, it pops up, and then you want to click this QA worksheets if they're not visible. If they are visible, you don't have to do anything. And this is how it should look like. Off to this left side, you'll see your images and everything. This will be where you fill out your worksheet. This will look blank when you first see it until I filled it out. And once I fill it out, it'll look like this. So you get my free text feedback first. This is basically the specific things that I had to say about your study. And in this case, you can see I said, hey, you didn't get all the views, try to get all of them next time. Roll the patient to the left or to QPath. This is a cardiac study, so that would make sense. Then this one is what says that this study was good enough that you get credit for it. So you always want a yes. I will very rarely give a no. Usually there has to be something really egregious. So I've had a couple of, for example, aortas without measurements. Even if it looks obviously normal, you have to take measurements at some point or I can't give you credit. Because there are some subtle aneurysms that you will miss if you don't take measurements every single time. And then you have your image quality here. And this is graded 1 through 5. And you want at least a 3 because anything a 3 and above is overwhelmingly getting credit unless there's some other major issue. Like even if your images were great but you didn't have an aorta measurement, I can't give you credit for it, right? So barring something like that, usually at least a 3 gets you credit. A 1 basically says I can't recognize anything on the screen. A 2 says I can see something but it's just not enough for the diagnosis. A 3 says there's some flaws but I can make the diagnosis. A 4 says this is pretty darn good pictures. The diagnosis is clearly very well supported, but there might be some minor technical issues that sort of limit what I can say about it, or something along those lines. And then a 5 is basically like, wow, these are fantastic images you should be super proud of, and there are only trivial if any errors. And then the last 2 fields are accuracy. You only see one of them here because I didn't put the other one just out of laziness. And this is one that I answer generally every single time, unless it's like ambiguous, right? Like if you do a cardiac and some of your interpretations are correct, some of them are incorrect, then you can't say true positive and false positive or true positive and false negative or whatever, so some of them it gets a little bit dicier to say, and I might just say ambiguous. But there's images as presented, and then there's images compared, and then interpretation as compared to whatever gold standard. So if you have like a CT or an op report or whatever that I looked at as well, then that's when I'll document that, hey, I looked at this other thing, even though for example, I could say, your study looked negative, but this study looked positive. That's the most common thing is you'll say, true negative on your study and then false negative on the confirmatory study is one of the common patterns that you'll see. So just a couple of little last things. I do send occasional reminder emails about unsubmitted exams. These are about once a month when they happen, just to say, hey, there's these exams that you haven't signed so that I can QA them. You don't need to reply, just fill out the worksheet and sign it, and I'll see it from there. We will be going through all of the ACEP approved exams throughout the year as plenary lectures, so you get a lecture on each of the core modalities by the time the year is over. Generally speaking, what I've changed to be doing is that if you guys have an ultrasound shift, that we have an agreement between everyone who's going to be there that day on what topics they want to cover, and then we cover those specific topics. So if you've been if you feel weak on a certain exam, and even if you want it every single time you're on an ultrasound shift, that's okay. You can say, hey, I still feel weak on cardiac, or I still feel weak on lungs. Can we talk about that again? And, we can talk about it till we're blue in the face, until you feel comfortable with it, and that's totally fine. This is something I mentioned in the syllabi, but if there is an issue, you need to contact me, right? This could be either an issue with the equipment, in which case it probably needs a phone call, right? Like either the ultrasound is damaged or non-functioning or something, and we tried rebooting it already, powering it off and back on, and that didn't work, and there's still problems, then that probably deserves a phone call. Clinically, I work nights, but if you call me multiple times, I usually wake up. So just make sure that you're aware that if there's a major problem, you need to get in touch with me. And then if there's a specific issue with one of your exams, like you're like, oh, I don't think this is good enough, or I have problems interpreting what I'm seeing, then it's much better if you email or text me ahead of sending the exam to me, because once you've sent it to me, that's basically you're saying I'm done and I'm stepping away and I want it to get reviewed now. Anytime before then, I'm totally comfortable intervening and saying, actually, this interpretation would have been totally wrong, maybe to the point where I couldn't give you credit for it, or it just makes more sense if you have a question about an exam, just email or text me, and we'll figure it out prior to you submitting it and signing it, submitting it to me. So, grand summary, right? Ultrasound is turning sound into pictures. You want to make sure that you learn our core applications and try to be really good at them. We talked about the basics of ultrasound, as well as a little bit more knobology with some of the more advanced stuff. Talked about QPath, what the interface is, how to fill out the worksheets, submit them, and viewing feedback. And now we're ready to scan.